Today, we're going to walk through diagnostic testing used to evaluate gastrointestinal function, specifically how we assess gastric acidity, absorption, permeability, and food reactions. These tests are commonly used to investigate symptoms including bloating, diarrhea, malabsorption, unexplained anemia, autoimmune conditions, and chronic GI distress. As clinicians, our goal is to match patients' symptoms with the most appropriate diagnostic tool rather than defaulting to broad or unnecessary testing. Throughout this lecture, I'll highlight which tests naturopathic physicians can order, which require additional certification, and which are no longer considered best practice. This slide shows us our roadmap today. We're going to start with gastric acid testing, including traditional gastric analysis, the Heidelberg test, and gastro-string test. Then we'll move into absorption testing, including Schilling's test for B12 deficiency, D-xylose absorption test for carbohydrate malabsorption, and the intestinal permeability test, or as commonly known as the leaky gut test. We'll also discuss testing for lactase deficiency and SIBO, small intestinal bacterial overgrowth, followed by a brief discussion of celiac disease evaluation. Lastly, we'll move into food sensitivity testing, including IgE and IgG testing, as well as our gold standard elimination diet. By the end, you should be able to match patient presentation to the appropriate diagnostic test. Before we look at testing, let's orient ourselves back to the digestive system. Digestion involves breakdown, absorption, and elimination. If any of these processes are impaired, symptoms arise ranging from nutrient deficiencies to autoimmune responses. Keep this picture in mind as you go throughout these tests today. When you see a test, think when in the pathway is dysfunction likely occurring. Many GI symptoms are relatively non-specific, so mapping the problem to the correct location is going to be a key diagnostic skill.